Hello and welcome to CGM Clinical and a rewarding patient engagement approach. In this session, we will explore the essentials of patient engagement. We will also distinguish the true definition of patient engagement as well as how to achieve rewarding patient engagement. We will discuss how to empower patients and their families and some tips on implementing the portal. We will review a patient portal letter, which should be given to the patient at the time of portal registration. Then we will take a look at the entire portal process from the provider as well as the patient's perspective. The topic of discussion in healthcare lately has been about how to engage patients in their healthcare. Patient engagement in the past was considered good, but today it is vital to the business of healthcare delivery. Patients' expectations are higher and they demand more control over their care. Thanks to the Affordable Care Act, healthcare organizations and eventually the practitioners will be paid partially based on how they are graded by their patients. Industry standards now focus on outcomes instead of the services delivered. Practices are responsible for improving clinical outcomes and being able to provide the data to support it. Patient engagement can help to improve efficiency, reduce mitigation, and overall costs of patient care. True patient engagement refers to the willingness, knowledge, skills, and ability of patients to manage their own and family members' health and care. The healthcare organization that supports a culture of patient engagement and collaboration between the patients and providers to design, manage, and achieve improved clinical outcomes. Did you know the Medicare Shared Savings Program includes 33 individual measures to assess the care provided by the Accountable Care Organization, or ACOs? 7 are directly related to the patient or caregiver's experience of care. There are others related to care coordination, patient safety, preventative health, and at-risk populations. Patient experience and patient engagement are not the same thing. Engaged patients maintain a closer attachment to their medical practices, experience greater value, trust, and quality in their care, which leads to greater satisfaction, empowerment, and an improved patient experience. To establish a vision of engagement, a practice must understand where it is and what the goal is in terms of patient engagement. What does your senior leadership, board, staff, and patients view as patient engagement? Develop an end-state vision of what the practice will look like when there is a strong patient engagement strategy in place. Achieving practice-wide support is critical for successful patient engagement. When the leadership team has been involved in creating the patient engagement vision, they are more likely to be enthusiastic in implementing it. Use policies and procedures when transitioning with patient engagement. Be prepared with and communicate the benefits of patient engagement for patients, staff, and providers. Having the right technology and services is critical to rewarding patient engagement. Patient portals enhance patient-provider communication and streamline staff tasks. Promote the portal to the patients. Track and celebrate portal milestones, such as a number of emails collected or time saved on phone calls, looking for paper charts, etc. Develop your own definition of an engaged patient. Characteristics may include seeking health information and knowledge, following treatment plans and medication regimens, participating in decision-making, using online health records, and engaging in wellness activities. Distribute short surveys outlining the values, goals, and needs of patients and families. Give patients opportunities to describe their perspective of the care experience. Involve the patients and families in process improvement, redesign work, and/or committees. Work with patients and families in any difficult situation. If someone calls because they could not perform it on the portal, walk them through the completion and encourage them to do it the next time. Promote the portal to existing patients and new patients as they come into the office. Make the benefits of using the portal clear and provide incentives for patients to use it. Providers should explain to the patients how the portal can enhance their experience. Walk patients through logging onto the portal and demonstrate how to perform tasks they will do regularly. Try to understand and address any hesitancy or concerns the patients may have with using the portal. Rely on the patient portal for as much of your communication to patients as you can. The more you use it, the more they will use it. Advertise the portal by posting signs, using telephone on-hold messages, distributing flyers, and/or the patient portal letter to patients. Make it everyone's job to encourage using the portal, from front desk and telephone staff to physicians. Develop talking points for staff that encourage patients to sign up and to use the portal. Develop policies and procedures for response times for messages and systems for routing and responding to messages. Minimize potential loss of patient interest by simplifying the registration process. Designate staff to assist patients with the registration process and to troubleshoot. Educate patients about what kinds of communications are appropriate via the portal, how and when providers will use messaging, and when to check the portal. Let's take a look at the CGM Patient Portal Letter, which should be given to your patient at the time of registration. The Patient Portal Letter is included in the CGM Patient Portal Learning Guide, which is available on the CGM training website. You'll notice the entire process is outlined as well as pertinent information that the patient should keep. This is a great tool for the patient's future reference. Registering a patient for the patient portal takes only a few easy steps. First, you enter the patient's personal email address in the Contacts tab of the demographics screen. Second, you click the Register Patient option on the Face Sheet toolbar. A window opens with the patient's personal email address, and you assign them an @direct email address. Once they are registered, you provide them with a super PIN that they need when they activate their account. For the patient to complete their registration, they must log on to the CGM Patient Portal website at the address shown here. If you have already sent something to their portal, such as a clinical summary, they receive a notification to their personal email stating that they have a secure message and provides them with a link directly to the patient portal, making it easy for them to access the site. From the website, they click the option to create their account. Then the patient is prompted to enter the provided super PIN, the first 3 letters of their first and last name, and their date of birth. Then they are prompted to create their own password to access the patient portal. Once this registration is complete, the patient logs on with their personal email address and newly created password. Sending a secure message is as easy as sending a message to another user in your practice. You simply select the Secure Message option in the same drop-down where Message is located. The Compose Secure Message window opens where you can easily enter your message and select Send. From the patient's portal, the patient sees the messages sent from the provider in the inbox queue just like any normal email. They click on the message line to view the message, giving the patient the option to reply directly back to the provider. When reply is selected, the Compose window opens where the patient can compose a reply to the provider. If you would like additional information regarding CGM Clinical and a rewarding patient engagement approach, we offer a variety of training options such as virtual, at your location, or in one of the CGM classrooms. Call 855-270-6700 and select option 4 or visit training.cgmus.com. Thank you for your time and attention.